Tafadzwa Chiganga, and you can call me Taffy. And I'll be talking to you today about mental health and list my experiences of it. I'm not a medical practitioner or anything like that. I'm just a human being who's gone through life, and I've learned a couple of lessons along the way. So hopefully I can share something with you today that will encourage you or inspire you, or in the list inform you about mental health. I had my first significant mental health challenges when I was in graduate school. I moved to a different country, and I arrived in totally different weather. It was winter, it was cold, it was dark. And I grew up in a country that always had sunlight. So just the deprivation of sunlight meant I didn't get enough vitamin D, and it triggered some kind of mental health issue. At that time, I didn't know anything about it. I didn't understand. I just preferred to stay indoors. I would keep all my lights blocked, so the windows were shut, the lights were off, and I would always be in bed. And I was staying with this old lady at the time, and she came to me and she's like, you need to get out. She just barged into my room, opened the windows, opened the doors. She's like, you need to get out and do some stuff. I just did not feel like it. Didn't want to eat. I didn't want to spread my bed. I just didn't want to do anything. And the truth is, I'm the person who wakes up a regular time, who's excited to spread my bed, excited to go take a shower, and excited to go through the day on a normal day. And I did notice it was a difference, but I couldn't quite explain it. I just thought, I was just off, right? So that was my first experience, and I didn't really get any help or any treatment. Kind of just, worked through it. I actually thought I'd missed home, so I did make a trip home eventually after about 6 months. And of course I got the sunshine, and I got some loving from the family, and I was okay. And then a few years later, I think I had the most chronic breakdown. So I was again in a different country, and the weather was not so different, but the people were very different. I lived alone. I didn't have a community to depend on. I could see some of my friends, but once in a while. I, however, think the trigger for that episode was my work environment. I worked in an environment where there was a lot of passive aggression or microaggressions. I felt I wasn't good enough, or was made to feel I wasn't good enough. And I was also the only woman in the office and the only Black person in the office. So it did feel like I've been employed as just a diversity tool, a diversity equalizer or something, but nothing that I said or did felt like it mattered. And to me, this was a very high impact situation. It made me question who I was. It made me question what I could do. It made me question my history and how I had come to be who I was at that time. Kind of feeling like I wasn't who I was. I just been lucky. And imposter syndrome kicked in. And then from there, I remember I called one of my friends to tell him that oh yeah, I'm just feeling down and everything. I can't say I am depressed, but I'm just feeling, not up to anything. At that time, I'd started having episodes where I could just black out. And the blackout is not I would pass out. The blackout would be I would be functioning on autopilot. I wouldn't really know what I was doing. And then I would have a moment of coming to. Then realize, well, I'm in the kitchen. I don't remember how I got into the kitchen. I don't remember what I was doing before that moment. And I started feeling a little bit more unstable because, I lived alone. So it was I don't know if I was going to be able to take care of myself. And then there was those similar symptoms with the first time. So I always preferred to be indoors. Everything was dark. I sometimes forgot to eat. And I tend to eat the same thing. So I was just having muesli and yogurt. Every time I felt like eating, that's all I could eat. I couldn't eat anything else. And then eventually one of my friends just said, you know what, you do sound depressed and you need to go and see a doctor. I did kind of resist it for a bit. And then I started having nightmares. So what happened was my mind would continue to function. It would not stop. So I would be thinking about especially work throughout the day and not being able to do anything about it. So I feel like I want to work. There's so much work. I need to do this, but I can't really get myself to do anything. And then I'd be thinking about it the whole day. You know, the thoughts around like, I'm not good enough. I'm going to mess everything up, and you know, the whole shebang. And then at some point, go to sleep and dream of the worst case scenarios regarding work. And so it felt like my mind was now constantly thinking and stressing about my work situation. So even when I was sleeping, I was not resting. I was just thinking about it. And I would have nightmares and wake up after like 2 hours and be up for another 1.5 hours before I go back to sleep and have another nightmare. So my whole life just became this like mushmash of work and stress, and I couldn't do anything in between, you know? And so I eventually went to see a doctor, and he diagnosed me with a mild clinical depression, and he gave me some medication. And the medication kind of just downed me out and enabled me to get some sleep. So I think what I've just talked about right now, the part that a lot of people think of when we're talking about mental health, is a full-on psychotic breakdown and being put on medication that dials you down. And people are afraid of that. But what I can tell you is, one, there are very different levels of mental health issues. You could have a mild depression, you could have a very severe depression, you could have a light depression, you could be bipolar, you could have the full psychotic breakdown, right? Like, it takes so many different forms and shapes. And the truth is, just because we're living the life that we're living right now, we are exposed to it. Like, it's not something that we should look down upon or think like it's associated with people who have failed or people who are not good enough. The truth is, we live in a very difficult world. Before the pandemic started, there were always issues, right? Now we're living in this era where people are starting to challenge some of the things that happened. The Me Too campaign talks of how women were sexually harassed at work. I've been sexually harassed at work. How did I deal with it? I just stuffed it down, right? But the truth is, it was inside me. It was affecting me. It made me feel a certain way. And that has an effect on my mental health. And it doesn't mean to say I'm not a strong woman. God knows I'm strong. I mean, who doesn't know? Like, I keep pumping every single day. But it's just difficult. It's just my body telling me this is too much. So imagine you take on sexual harassment, you take on racism, you take on the passive aggression, you take on all these microaggressions in different environments. You are filled with so much doubt within yourself. Sometimes it affects the chemical balance of your brain, and that then affects everything else, right? And I just want to talk about it today and encourage someone and say that, like, it's completely normal. You're not any less of a person just because you're going through that. And for those who want to say they have never gone through it, I'm really happy for you if you've never experienced it. But don't be quick to judge a situation you don't understand. Offer to support. One of the things that really helped me is having a friend. I remember one of my friends who was living about 4 hours away from me invited me to her house. Hi, Tatinda. Thanks, big sis. She invited me to her house, and I spent 3 days with her. Just 3 days. And I was just telling her every little thing that was bothering me, what had been going on, and all she did was listen, you know? And sometimes that's all we need. Sometimes the world feels so heavy, it feels so burdensome, and all we need is somebody to listen to us, not somebody to come and judge us. That's going to put even more pressure. Someone to come and place more doubts on us, that's going to put in so much more pressure. I want to highlight that work environments have, from my experience, become some of the most dangerous places to be, especially for your wellness, both your physical and mental wellness. So be careful the work environments you choose. Some bosses are narcissists. Some are just downright cruel. Some don't care about you, right? Remember to take care of yourself. If you feel that the situation is not comfortable, don't doubt your intuition. Trust it. Let it lead you and guide you to making the right decisions. And I know I can say this because I have the luxury of the choice. Sometimes you don't have it. Sometimes you have to stay on the job because you have to pay your bills. You need to feed your family. But remember to try, by all means, to have some kind of balance between what happens at work and what happens at home. Never take your work home as much as you can, especially in this pandemic. Why? Because you already have a lot to take on. Some are homeschooling their kids. Some have family members that are not doing so well. Some of us are exposed, right? Some are living in countries where the health sector is not so strong, so you never know what's going to happen. So I'd highly recommend take good care of yourself, especially in a work environment. And then I just wanted to also highlight that mental health affects both men and women, and almost the same, right? It's not gender sensitive. It's not like, oh, you're a woman, so I'm gonna give you 10 times a dose of depression, and you're a man, and I'm gonna give you like 5 times a dose. The truth is, it all depends with how we deal with the situations we find ourselves in. And given the way that men have been raised historically, what they have been told about how to be a man and what it means to be a man, they tend to be more exposed to these mental health issues. They tend to have to keep more down if they're feeling emotional. They can't cry. If they're feeling down, they can't talk about it. They're told to be a man about it. And I'm calling out to all my brothers, to all my fathers, my uncles, my friends, that like, it's not true, y'all. It's not true. You are just a human being, and it could be hard. And when it's hard, talk about it. If you want to cry, cry. That's exactly what men do. Don't worry about anything. That's my dog. It's getting excited about a bowl. But anyway, that's exactly what men are supposed to do. Everything else we've been told are just, lies as far as I'm concerned. And it hurts to see how people struggle with these issues just because of societal pressures, right? So yeah, if you are a sister, a husband, a wife, a partner, also keep an eye on your other half, your other partner, your sibling, and create an environment where you guys are able to talk to each other. I actually believe that the reason why so many marriages fall apart is because there's really poor communication, and that is all around these morals and values that we've been taught to uphold, and people end up getting depressed and unhappy and are not even able to express themselves to the people that matter the most. So yeah, just wanted to touch on that as well. And then one last thing before I go, I really want to talk about is this pandemic. Okay, so if it has not affected you directly, if it has not affected you within your first family, or affected your job, or affected your kids going to school and you having to take on some extra time to homeschool, then count yourself super blessed, super lucky, because you're amongst just a few, right? The pandemic just has made everything else so complicated. And I want to say, this is the time to take care of yourself. This is a time to embrace mental health issues and talk about them. That's why we're here. That's why I'm talking about it today. Just to encourage you to speak out, seek help. The symptoms are not like so, the way when we think somebody is sick, we expect them to be like, oh, they've got a fever, or or they got a stomach bug, or it's something that's so tangible. But even if you feel like you cannot touch it, if you can feel it, it's real. And deal with it from a place of knowledge that this is how I feel, and how I feel is valid, and what I feel is real, and I probably need to get some help. Therapy, if you're lucky, if you can get a therapist, get somebody to talk to. Otherwise, we have to count on our good old friends and family to offer a listening ear. So if somebody comes to you and tells you, I'm a little down, don't be quick to brush it off. And don't be in a hurry to say, hey, how are you doing? And then somebody just says, fine, and you take it and you go. Take the time to actually ask each other, how are you doing? Anyway, guys, take care of yourselves. It's time to go and probably catch a nap. Cheers.